Hi, my name is PA Clarke. I am a facial aesthetic specialist and pioneer in facial rejuvenation using the best products and the latest techniques to keep my patients happy. We will be talking about facial beauty and what is possible with non-surgical facial rejuvenation. At Dermaworks MedSpa, we deliver amazingly natural, life-changing results. We help you consider what's possible and work with anyone wanting to reverse the visual signs of aging. But best of all, our results last. Hi, welcome back to Dermaworks podcast, where this episode is on rapid fire, answering the burning questions that you have. So we pulled together a number of questions from our audience, and we're gonna shoot these questions one by one. So hopefully you'll be informed of some of the content. Here we go.
Are fillers better or Botox?
Are fillers better or Botox? Well, this is like asking, is milk better or water? They're completely different modalities. Botox in itself helps to relax the skin, removing some of the facial lines and wrinkles by acting upon the nerve. However, fillers act to enhance the volume and the angles and the curvature of the face. Two completely different things occurring.
Why do people say you have a miracle treatment chair?
My miracle treatment chair, I'll tell you, when you're in my chair, I know exactly what you want. You're leaving with exactly what you asked for, and you're leaving looking better than when you came. That's the miracle about it.
Why do you approach your work like a sculptor?
Sculptor. So I would say, this is really dear and close to me. Everything we do is sculpting when it comes to rejuvenating. We're changing the face, therefore we must understand how we're changing the face. Look at some of the famous violins out there by Stradivarius. So these violins were made and they're so amazing, the sound quality is so good. Why did that happen? Because of the technique. The technique says and does everything. Without the technique, you cannot sculpt. If you're just filling, if you're just sticking a needle and hoping for the best, you're not sculpting. We are all sculptors. This is an art form.
Should I be nervous about getting injections?
Of course you should be nervous about getting injections. We are changing your face. We are changing your appearance. We're making things where they were not before. We are hopefully enhancing you. The only thing you should be afraid of is who is injecting you. But nervousness is a natural reaction.
Why are your before and after pictures so important?
Here's the thing. Before and after, if you cannot see the difference, sometimes you may feel that your results were not good enough. So before and after pictures allow us to really reevaluate our technique, our results, and for you also to reevaluate why you're going to that particular injector and whether or not your results are actually there. So I would always say, you as the patient, take a before picture while you're in that chair with your own phone, and then take an after picture about 2 weeks later.
How many appointments does it take?
Typically, it should take one appointment. However, I like to see my patients in 2 weeks. I need to understand what I did, and I need to reevaluate what I did, whether it was necessary, whether it was optimal, and whether my patient is happy. I want to make sure you're happy. I want to make sure I'm happy. So I must see you on that follow-up. So reality, 2 visits. First is the treatment, and the second is the follow-up.
How many times will I need to come in until I see results?
Again, one time for results. The follow-up is just there to fine-tune if necessary. But one time is the only time you need to visit to have your results.
How can I tighten my skin without plastic surgery?
Tightening the skin without plastic surgery, there's so many modalities on the market. There's radio frequency, there's ultrasound, which uses oil therapy. There are many mechanisms in place to tighten the skin. You must understand how the skin functions and works in order to really believe in some of the tightening procedures out there. Some of the least costly ways to tighten the skin is something called microneedling. Microneedling damages tiny perforations it creates within the skin itself, which forces your body to regenerate and grow. That is new skin, that is new collagen, and more than likely you have more tightening within the skin, and this shows up as reduced or smaller pore sizes within the skin.
What is the best age to begin Botox?
Best age to begin Botox is when you foresee an issue and your provider recommends you to have that treatment done. Now, does that mean you should have it at 12 years old? No, because your provider should not foresee a problem at 12 years old. However, if you are 18, 19, 21, of course, if there's something that's damaging you psychologically, if there's something that can be easily remedied, and it's giving psychological harm because of what you have, that would be the right age based upon an understanding with your medical provider.
What are the most common areas on the face for injectables?
The most common for injectables, let's break down injectables, that's Botox, quote unquote, and fillers. So the most common area for Botox would be the glabella zone or the crow's feet for injectables. When it comes to fillers, the most common is going to be the lips, hands down. Everyone wants to have the lips enhanced because the lips are one of the first things to get smaller. You get more lines within the lips. The shape of the lips change slightly, and all of this happens after the age of between 21 to 25.
What should I look for when searching for the best cosmetic PA?
Well, first of all, you shouldn't look specifically for one profession or professional within this industry, whether it's a nurse practitioner, nurse, physician, or physician associate. You should basically look for any of those 4 categories that does a great job. So it should never be, I want an MD only, or I want a nurse only, or I want a physician associate only. It should be, who's the best injector for me, and that's going to be the individual that proves to you that they have a great results and the reviews show it.
What is the downtime on lip fillers?
Downtime on lip fillers maximum should be 2 to 3 days. Sometimes maybe 1 to 2 days, but this depends on the product being used. Some products expand so much that you need more time. More than anything else, the technique that was used on your lips determines how long your downtime is. There's a popular procedure called Russian lips, and I'm telling you, they're going crazy with Russian lips, and you're getting bruising and swelling and bleeding. This is not normal. Don't ever let your injector tell you a lot of bleeding is natural. It is not. I find that with some of these techniques, you're actually damaging the lips. You're damaging the structures of the lips that maintain the lips the way they are. And eventually, you will have problems with the symmetry and the form of the lips. So the downtime depends on the technique your injector is using. If your downtime is 1 week on lips or 2 weeks, then the technique is at fault, and you need to let your injector know so that they can do better next time.
Can you tighten loose skin without surgery?
100% you can tighten loose skin without surgery. The question is, how much tightening can you get without surgery? Now, and which one is more natural? Surgery doesn't necessarily give you a natural result. And the huge negative with surgery is that you're left with scars. Whether the scars are minor or tucked behind the ears or tucked wherever, you're left with scars. Scars can present you as looking older. Scars can present you as having maybe a tighter face, but trying to look older. So tightening the skin without surgery is 100% doable. The amount of laxity and tightening that you will see will be determined by the modality being used. lasers, such as ultrasound or radio frequency, microneedling with radio frequency. These are all modalities that help tighten the skin.
Does collagen tighten saggy skin?
So collagen is natural in all of our bodies. So when we say collagen, what do we mean? Collagen, what do we mean? This is a term I feel is being used very often without truly understanding what collagen is. Collagen are just proteins, and proteins that are built up within the skin. We all have this. Collagen can be tightened naturally using some lasers, but more than anything else, stay out of the sun. The sun is going to damage you. The sun is going to age you. The sun is going to break down your collagen quicker. Number one. Number two, free radicals. Free radicals are things that accumulate within the body after eating foods that are not necessarily good for you, or after eating foods that are good for you. So free radicals sometimes is the waste or the byproducts of whatever you put into your body. Free radicals can be increased by the sun. Remember, free radicals in the body is not good for your body, and so we need to take measures to eliminate or remove free radicals within the body.
What is a lunchtime facelift?
Lunchtime facelift is what you get with me when you come on your lunchtime. And what do I mean by that? Lunchtime facelift is getting into your practice's office and within 15 minutes looking younger and brighter and better than you walked in. So the statement here is looking better upon leaving than you came in. If that isn't happening, it's not a lunchtime facial, it's not a lunchtime facelift.
Why should I come to DiamondWorks MedSpa?
This is a hard question, and it's a very easy question also. DiamondWorks MedSpa has been around for quite some time. We have a ton of experience. You look at our reviews, they are amazing and they are true. There are many ways that we can give you what you want depending on the modalities that we choose. DiamondWorks MedSpa will always give you a natural looking result and will always give you what you're asking for and never something else. For example, let me expand upon this. Many times you may go to have your nasolabials done because you have a deep crease. And one of the trending procedures is to enhance the cheeks to create stretch and tightening to help this region. That doesn't work. What happens, it creates more width within the face and it starts to actually widen your face, and within a month or two the line is back. So you're still where you started, except you've got bigger cheeks. And this is what I mean by giving you exactly what you need by doing the procedures and using the techniques that are right for you. Thank you for watching Quick Rapid Fire 1. We did great. I hope you understood. I hope this information helped you. But remember, it's up to you to have another rapid fire episode. So post your questions below. Make sure that you subscribe. Make sure that you're following us and leave us the questions that you want answered. You will get very honest input and information. So next episode, Quick Rapid Fire 2, coming soon. Hey guys, if you're enjoying these videos, take a look at my new book, The Lust for Medical Beauty. This has everything you need to know about the origins of facial beauty, where it can take you, and why we need so much more. So check out Amazon #1 bestseller. It's the only place you can get it now, The Lust for Medical Beauty.